Well, I hope that you picked up a handout when you walked in. Does anybody have a complete? Yeah, thank you. It should contain this wonderful book called Prepare to Care. So I encourage you to take the booklet inside. I color-coded things so I could refer to them. The blue page is very important to me. It tells me and the Education Committee whether this program was meaningful, well organized, presented clearly, etc. But equally importantly, I'm giving you the opportunity to tell us at the Parkinson's Association any other programs of interest or key subjects that would be helpful to you. So I would be most grateful if you would fill this out. Don't need to put a name. Drop it on the table before you leave. Then, as I prepared the program, the last issue that I talk about is caregivers, are you taking care of yourselves? That's so important. We can only give outstanding, compassionate caregiving if we're taking good care of ourselves first. So I found these two handouts from programs I did years ago, the pink and the yellow. So I encourage you to take a look at that. And then I'm going to refer very briefly to creating a care map. And I'll just let it be at that and pique your interest, and we'll go through the program. So these are the handouts. I had to put the picture of this very handsome man who was part of my life for 30 years. His name was Don Underdown. He was my husband. He had Lewy body dementia. I was a caregiver for a number of years, but a full-time caregiver, meaning I stopped my job and made him be my priority. It's significant that I'm doing this program today because it would have been his birthday. So he has definitely always been my inspiration, and I am grateful that he was a very important part of my life. Rosalind Carter had 4 important things to say about caregivers and about us as people. I'm sure you've heard this quote before. It's been said numerous times. There are 4 kinds of people in the world, and we're going to fit maybe all of these roles. Those who have been caregivers, those who currently are caregivers, those who will be caregivers, and for some of us who at some point in time might need caregivers. So we all should have a vested interest in how to do a good job of this caregiving. And what is caregiving all about? Well, many of us have or have had jobs and careers in our lives. I would like to propose to you that caregiving is probably the most important role you will undertake ever in your life, especially if it's caregiving for someone that you love. So think about both the privilege as well as the responsibility that comes with caregiving. And I connect the word compassion to caregiving because we better have a healthy dose of compassion as we move through the challenges that we face as those we care for, our loved ones, move along the path of severity of their illness. And my definition is giving physical, emotional, social, and spiritual support, not necessarily going to church, but from the spirit, from the heart, to the person in need, be that a caregiver that you're paid to take care of or your loved one that you give from your heart, with tenderness, sensitivity, and skill. And probably any one of us will be tested somewhere along this caregiving path of, am I patient enough? Have I given enough? Am I doing things specific chores related to caregiving? Am I doing it right? And I would suggest we all learn as we do. What I think it takes to be a compassionate caregiver, first of all, are skills. We have many of the skills because we have to use these skills for ourselves: bathing, dressing, eating, mobility, toileting. And yet, when we're doing it for someone else, there's a bit of a different spin on it, isn't there? We have to think, are we making them feel comfortable during this process of providing care? Care, a healthy dose of patience, and a whole lot of love. AARP is excellent at gathering and then providing statistics about caregiving. And this was in one of the AARP bulletins just this year. How many are AARP members? Almost all of us, yeah. Family caregivers, stop and think about this, because we do it without thinking the cost of what our services would be if we had to pay for it. Family caregivers provide 36 billion hours of unpaid care. How many find that to be an absolutely astonishing figure? Do you ever even think about the value of what you're doing? That was in 2021. We all know how costs have changed. So I would escalate that number probably by about 20% for 2023, worth $600 billion. So what we're doing from the heart and the spirit has true value. An average family pays $7,200 a year, and I'm going to suggest that's way on the low side for other needs. So that could be out-of-pocket costs for medication, it could be for medical equipment, it could be for caregiver services, daycare, on and on and on. For many caregivers, and I started out this way, I was working full-time and trying to be a caregiver too. And I realized I was kind of doing a lousy job of it. Because for my generation, the job is pretty important and you want to give it your all. Does that mean we shortchange the person we love? Not on purpose, but you can only stretch yourself so far, which is what prompted me to leave my full-time job. And in order to be a full-time caregiver, I wanted to be closer to my biological family, which happens to be in Pennsylvania. So I made the biggest, bravest, craziest decision, but absolutely the right decision. I left my job here, rented my house. Thank God I didn't sell it. I would have never been able to come back. And moved to Pennsylvania and was a full-time caregiver for 3 years. So I really, truly walked in the shoes, and I learned so much more than I ever learned in nursing school, nursing on the floor, senior care nursing. When you're in the role and assuming that responsibility, you learn more than any book can ever tell you. We know that family caregivers, as I just said, try to juggle their job and the caregiving role, and it's a very intense process to juggle both of those things. And we know it's not been something new, but we know that COVID exaggerated the caregiver shortage. So you can call any agency that is a home care agency, whether or not you can get the shift filled the same day, the next day, or the week. And many people left the caregiving field during COVID. So we know this. You know, the hospitals hire nurses from agencies and so forth. So we're really managing a very difficult issue here. These are the steps that are outlined in this wonderful booklet. And the reason I want you to have it is that you've got something in writing to bounce back on. There's also several pages of glossary of terms and resource information. So I hope actually you consider this a wonderful gift from AARP. But this is what they outlined when I watched the webinar, so I've created the program based on this. Starting the conversation, let's talk before the crisis about what the needs might be, where the living might be, how to get the care, how to pay for the care, the living lifestyle, all of those things, and advanced care planning. Important to do that before a crisis happens. How many of you who are caregivers will tell me that you can do this alone all by yourself? Anybody? How many know how important it is to have paid caregivers, families who will be on your care map, neighbors who are willing to do errands or cook a meal or pinch hit if you have to go to a doctor's appointment? Gotta totally need to have a team. Make a plan so you're prepared before the emergencies or the changes happen. Find support, and most importantly, take care of yourself so that you stay well, because we're only as good as a caregiver as we are about taking care of ourselves. So, number one, start the conversation. So this is about being educated, what the path of Parkinson's is, because it is a long, drawn-out illness for many people. For some people, it's shorter, depending on the age at which someone is diagnosed. And we do know that people are getting diagnosed earlier because of more sophisticated investigative tools, and that people are being diagnosed at a younger age. So you can see then that there can be a long period of caregiving needed. Who takes the lead role? Who's going to map out the plan? Who is going to make sure that the medical care is right and at the appropriate times? Who's going to make the decision regarding outside caregivers, regarding where's the proper location for the care, and all that goes with caring for someone in a long-term chronic illness. And get input from stakeholders. Who would the stakeholders be in your circle of life? Anybody? Stakeholders? Children, family members, your medical team, specialists, people that know you very well, that you feel confident you could trust. They would tell you how they perceive you are managing this challenging role. So, conversation process. Look for an opening. Sometimes the opening is an icebreaker, such as, I just attended this article that the Parkinson's Association put on, and they had these suggestions and ideas. Can we gather as a family and sit down and talk about them now before the changes occur and we have to make decisions quickly? Let's air out our thoughts. And I want to say here, it's really important to have the patient, the care receiver involved, so that they can talk about what's important to them as they become aware of changes happening. Attended a program, a friend or colleague mentioned something, maybe you heard a story in your support group. Any of you in support groups here? Any of you find helpful tips from somebody else who lived through it, and you decide, hey, I heard so-and-so experience that same thing, tried this, and it was a successful outcome. And listen, I think throughout life, we have to be better listeners. We can hear things, but it doesn't mean we take it all in and process it. I want to share a story that a minister gave at a homily last Saturday. He said, my dad's whatever he is, in his 90s. He's been a widower for 15 years. He just decided it's time, I'm done with this. I want to go to some kind of senior living environment. So they looked all over, chose the place, and as part of the interview, father and son went for this process, and part of the interview involved a little mini mental test. So draw this figure, and it's to see how the brain is working, to see if you can correctly replicate what you see and repeat what you hear. So Father Garrett said, and then came the 3 words. He mentioned the 3 words, car, table, cereal, whatever it was. And then they went on to talk about other things and do the drawing. And 2 minutes later, the interviewer said, and what were those 3 words? Dad could only come up with 1 word, but the son could only come up with 1 word. And the take-home message there is, do we always listen? And we need to be better listeners. How many of you left the doctor's appointment and said, oh my gosh, he said so much and it was so fast and it was so much a second? You don't remember exactly what the whole conversation was. So we do have to practice our listening styles, I think. Some things that all of us, these are just good techniques for conversation. Don't anticipate the answer, or don't fill in part of the sentence. I can be very guilty about that myself. Really let the conversation flow in a natural manner. Are all the answers going to come and be clear the first time you sit down, or the first time you go to a neurologist, or the first time you gather as a family to discuss how lives might change? My guess is no, it happens over time. At least that's the way it was for me. You kind of have to be walking in the shoes of caregiver and being part of that daily life of the changes to know, I didn't think this thing through carefully. We have to go back and talk about certain issues again. So my suggestion to you is the plan evolves over time. And the changes and life circumstances may alter that plan. Go with it. Never forget to express love and concern. While we're caring for someone, it doesn't mean we totally understand what they're going through. You know, until you walk in the shoes, you really don't know what it's like to be experiencing life-changing patterns. And back to the listening part. I want to also, again, because I spent almost 4 years with Hospice of Santa Barbara helping people get their advanced directives completed. Do you all know what an advanced healthcare directive is? Okay, so if you didn't raise hand, it is the opportunity to sit down with those you love and care about, as well as your medical provider, and talk about the care you would want or not want in a life-threatening emergency, and who you would choose to be your decision maker. And then you've got to move at some point from talking about it to actually completing the document. I did bring with me the My Care document. Judith, I heard that they can't do the program this year. I'm sorry. But Hospice of Santa Barbara does conduct these programs, and they do have volunteers that will come to your home. Jane is a volunteer, and walk through this document with you, explaining it, because there are some nuances that can be a little confusing. But this is meant to speak for you should you ever be in a life-threatening crisis and unable to articulate your own decisions. So very important to have this in place. Everybody in this room, I'm going to say now, not in the future, now. This is an advance directive. So this is a form, this is pretty popular here in Santa Barbara because it was created by Cottage Health with a number of local healthcare providers. So it's written in a way that's a little more user-friendly, and it's certainly more desirable to have a document like this as opposed to an attorney-driven document, which is 12 pages of a lot of legalese. This is very straightforward. So I'm happy to discuss this later or to do a program, whatever, if that's important to people. Along the conversation process, I think it becomes all too natural to make decisions for someone else, even though they're capable of making their own decisions. So again, part of the conversation has to include the person with the chronic illness. We can't go and set out a plan for someone with no input from them. We need to hear what this person has to say. The care receiver should be involved. It's not a process of the spouse and the kids get together and make the plan for the other spouse, and you kind of have to go with it, whether you feel good about it or not. So make sure that care receiver is involved. Some groups have a natural leader. Others, you may have to coach somebody. It might be the oldest child, the youngest, the spouse. Whoever can competently lead the discussion to cover all the bases. Have in mind the goals that you want to accomplish. Safety, quality of life, compassionate care, staying at home as long as it is physically safe and possible. The goals are your goals, not goals you get out of a book. Understand the priorities. I want to stay at home no matter what. What will it take for that to be possible? And planning it well in advance is pretty important. Sometimes there's an outside facilitator needed if the adult children are at opposition, or there's a very large family, 5 kids and 5 different opinions, and nobody can kind of pull it together. So there are professionals who will fill this role. Back to listening, understanding what the priorities are, and then to a pretty major degree, choices have a lot to do with the cost of care, the financial resources, and what seems to be the best fit in your particular situation. This is not a one-size-fits-all by any means. And options and needs most obviously change over time, so being flexible about that. Counter resistance. I don't know about you, but have you ever been in groups where there's a naysayer in the group, and no matter what you say and the plan sounds really great, somebody's going to be there to shoot it down? So kind of think about the resistance part ahead of time so that you can plan for the conversation to stay on target. Someone needs to bring the outliers back in to stay focused on the plan that you're trying to create. And usually a trusted friend, a physician, a doctor, someone from the faith community, maybe a close neighbor, someone that's going to be the ally to help bring some form of consensus is important. Anything about that conversation that you have a question about? You all see the importance of it. The plan doesn't happen without lots of conversation. Look for team members. So no one person in a household can do this by themselves, no matter if they think they're a captain hero or have all the resources at their fingertips. We all need someone else. I suggested start with a care map, and that is in your handout. It forces you to think about people and resources that you might not otherwise have thought about. So if a neighbor has said to you at some point in time, if you ever need anything, give me a call. Well, if they were genuine about that, the need anything might be grocery shopping, shopping for incontinence supplies, something that isn't caregiving and it's not hard, but it really helps at a time of need. Family members, of course, volunteers. We all need someone near and far. Maybe someone to help with financial planning, because that's a big part of this as any chronic illness progresses. Try to identify, once you've come up with who the people are, what are their skills that they can bring to this. I will tell you, people in Pennsylvania are the friendliest doggone people. Now, I was born and raised there, and I consider myself pretty friendly too, but I was amazed. I moved to a street where I knew no one. I had been gone for 35 years. People were fast to knock on my door, welcome us to the neighborhood. What can I do for you? The first week, I had different neighbors bringing meals over. Doesn't seem like a big thing. It was huge to me, absolutely huge. And along with that, call anytime you need anything. And we like a nice fire in the fireplace on these cold nights. The next door neighbor had an adult son who knew where to get the firewood and came and delivered it. So, you might not build that into a care plan, but it becomes pretty important down the line. Be inclusive near and far. So when I'm back in Pennsylvania, I'll tell you, my California friends were on the phone to me or on the email, making sure that I was doing okay, because even though I had family in the town, when you're gone for 35 years, things change. Relationships change. So those faraway phone calls really sustained me. Make sure that you've got a supportive team. They're going to be able to work together. I've put cross-training here because I think it's important as care reaches the point where you have somebody in the morning, somebody in the afternoon, maybe somebody at night, or maybe at some point round-the-clock care. If someone calls in sick and can't do it, it's pretty important that you have a backup that can conduct the care and the services that that person who can't be there normally does. Make sure people are clear about their roles and responsibility, and always the focus, the center needs to be that person who is needing the care and support. They are our primary care. I put together, when I help and go into a home and help people figure out what they're going to need, how much care is needed, what the options are. It can be a notebook, it can be a binder, whatever you choose. And I brought this along just to show you. It is so important that the person who has provided the care leave some kind of a track record on what happened that day, good, bad, and indifferent. So I have here a care plan, an advance directive. So if something happens in the middle of the night and the primary caregiver is out of town or unavailable, you look at this directive and you know who is the decision maker, who do I need to call, and what are this person's wishes. Daily notes, what happened, how was the diet, were there any problems with bowel or bladder or mobility, any conversation that might be important to record, something the person said about their wishes or feeling depressed or down. These are all a trail that will help the other caregivers know what happened the night before, the day before. Medications, of course, very important because at some point the caregiver will be at least monitoring the medicines to make sure they're taken correctly and on time. And then I put a little tab in here on incident reports. So if there's been a fall or an injury, a bruise, nausea, vomiting, something that's out of the ordinary, you don't have to read the whole day's notes to find out, oh, he fell and I need to check his knee, there was a skin tear. So I've made up a little incident report. This is just meant to help you communicate with the team. Review and revise it as the needs change. As the condition changes, the needs will change. So keep your caregivers, your family involved. Stay clear about the goals. The goals might not be to ride the bike or run the race, but the goals might be, let's get them out of the chair and walking 3 times a day, or doing range of motion so that whatever is left is maintained. Keep all informed either through the book or phone call, and take notes and summarize maybe how the day went or how the shift went. So that helps the family member. Fourth, on how do we prepare to care, find support. I've put here a few of the local phone numbers or contacts that might be of value, and I want to tell you all excitedly that we will have a new senior resource directory. And this will be the first one since 2018. And that will be out, really showcased at the Senior Expo, which is happening October 4th. Let me also tell you about the Senior Expo, and there are flyers over on the table. We have 100 exhibitors. So this ranges from home care agencies to senior living communities, to Medicare supplemental insurance, to advanced care planning, you name it. They will be there. Additionally, we will be providing flu shots, and my guess is the COVID booster may be ready. So we've partnered, a team of us. I'm not doing this myself, needless to say. It's under the guidance of Family Service Agency, but the resources will be plentiful. Wednesday, October 4th, 9 to 1. Elder Care Locator, which will lead you to resources in your community. I put up there Senior Connection. This is a program of the Area Agency on Aging, which serves Santa Barbara County and San Luis Obispo County. They're a wealth of resources. Transportation, meal deliveries, home supplies, anything that a senior might need in order to stay at home, stay safe, and have the resources available. So I will pick up 100 resource directories for the Parkinson's Association. I'll get them over here. And certainly if a church would like a stack of directories, you can call the Area Agency on Aging or let me know, because they will be bringing down about 5,000 directories, and I'm happy to take 100 to give to here and there to save organizations from having to make a trip or wait. Another form of support is consulting a professional who understands how to do an evaluation, assess the medical, social, emotional, practical needs that might be involved with caregiving, and then connect to the resources. A number of workplaces have employee assistance program, and this is pretty big in the big employer groups. So you think about Deckers and Santa Barbara City College and UCSB, they all have employee assistance programs. And maybe even small groups too. So I think if you're still working, it's worth that question to say, is there anything that can help me get through this caregiving process? It might be your faith community, and there is an 800 number resource line. And again, all of this is in that wonderful booklet I'm sending you home with. Then we talk about hiring help. There reaches a point if and when 12-hour care, 18-hour care, 24-hour care is needed. No one person can do that alone. There needs to be some kind of a support system. So as you contemplate putting that support system together, identify what the needs are and be focused on what's a good match. So a good match is, does this person have the skills that are needed to provide this caregiving support? Are they a good practical personality match? Nothing worse than having a chatty Cathy with someone who is more quiet and reserved. So really try to work on knowing a little bit more about the persons coming into your home. Be specific about what your expectations are. We like to think that people have their eyes open and they can see what the needs are and they'll attend to it. Not everybody's like that. They need to have it written out. Monitor and evaluate, and if it's not going well, sit down and have a conversation with the person and outline what isn't working and how to try to make it work. And if that doesn't resolve the caregiving or the personality conflict issues, you might need to make changes. That's okay. Not everybody's a perfect fit. Better to make changes than to observe changes, such as care not being provided up to your standards or personality conflicts. We're not all meant to be a perfect match with everybody. These are the caregiver options I'm sure you're familiar with. There are, when I first moved here in town and I started a caregiver agency, and there's someone that worked for me 40 years ago as a CNA and went on to become a nurse. Carol is still a good friend. Know what agencies are in town. In 1980s, there were maybe 5. There are now probably 35. And they all have their own price range, their own capability for services, and so forth. So scout around, make calls, know what you're looking for, and have a list of questions ready to go when you call. Another option is hire privately. That means someone tells you they know someone that has been a caregiver for a friend. Still say, check references, interview this person, make sure it's a good match for your particular need. and outline the roles and the expectations. I also say it's a good idea to put a rider or an umbrella on your homeowner's policy, because if you go through an agency, they come with all those assurances of workers' comp and bonding and so forth. But if you're bringing someone in that you hire, the buck stops with you. So make sure that there is coverage on your homeowner's insurance plan. Sometimes family members can take over and assume some of the caregiver roles. And then back to the care mapping that we talked about. Who made mention some time ago that they would step in and help if and when you needed it? Think about safety all along the way. So whether it's Parkinson's, or with my husband who had Lewy body dementia, there were Parkinsonian features. So biggest issue was the shuffling gait, which means trips and falls. Grab bars, rails, lifts, shower equipment, shower chairs, portable hose, all of those things that make caregiving easier for you and for your loved one. And then there may be a point in time where you think about lifestyle changes, which is a care community. And I've just outlined here. Assisted living, they're smaller, most generally. They provide caregiver support, but they are not required to have licensed nurses. So that's important to know. They are required to have caregivers round the clock, but they don't have to be licensed care. So if there's a skilled nursing need, assisted living may not be the answer. Memory care, an assisted living community that is really geared to address the cognitive issues, the social functioning, much more activities and entertainment, really to bring out the best in whatever skills and abilities are left. And then skilled care, that is nursing home level. And in that level of care, licensed nurses are required 24/7. Just so you know, home care, privately hired, you're looking at $30,000 a month. Assisted living, you're looking probably around 10, depending on the level of care. Might be 8 or 10. Memory care, for sure, 10 and up. And skilled nursing, probably around 15. Now, someone might qualify for skilled nursing for rehab and have it covered under Medicare for a short period of time. People have the illusion that, oh, if I go to skilled nursing, Medicare pays the tab. Doesn't work that way. You get 100 days benefit, but you have to prove a skilled nursing need. Dressing changes, tube feedings, rehab, any of those services. And then once the individual plateaus, meaning they're not making improvement, they're not getting worse, but they're not getting better, Medicare cuts off. So when might this be of value? If anyone here has long-term care insurance and you have home care needs, don't wait. Activate that policy. You've probably been paying for it 10 or 15 or 20 years. So that becomes a wonderful adjunct to being able to have care at home and have some of it paid for. Caring for yourself. If you're providing some kind of support, whether it's emotional support, financial support, or computer expertise from a distance, but you're one of a team, it's really important that you know what the others are doing and that they know what you're doing. So I really believe it's important to have a Zoom call or FaceTime so that everybody that's caregiving near and far hears the same thing at the same time. really important. Because when we represent things the next day, you know, you tell the first person a story, and by the time it gets the person in the back, it may just be a fraction of what it started out as. So really important that everybody hears the same thing at once. Think about the Medical Leave Act, where if you're a part of a large employer, you'll get some financial subsidy for time off. All of these are extremely important that I don't believe need any explanation. Bottom line here, take care of yourself. If something happens to the caregiver, and even though I've been doing this for a million years, I kind of didn't get it when I was walking in the street. I can do it all. I can do the grocery shopping and cleaning the house and the caregiving and the mowing the yard. You can't do it all by yourself. You get tired. You need a break. So respite, that time away, is important. And I think there's tremendous value in support groups. More than likely, someone's going through the same thing or has been through the same thing and can give pointers on what worked. And wrapping it up, you're either really engrossed with this, you're tired, you're hot, or I would love to have some comments and questions at the end. But this is my spin on what it takes to be a compassionate caregiver. And I just made this up. I was writing an article about caregiving, and I said, what are some of the traits that I think are extremely important? It's probably the most courageous thing any of us will ever do in our lives. Because caregiving for an adult that we love is much different than the caregiving we do when we bring new life into the world. It takes commitment, creativity, your heart has to be in it. Being with that person, trying to just imagine for a moment what it must be like to not be able to get your thoughts out or to not be independent in normal daily activities. And then it takes tons, love, laughter, learning, and letting go. Don't try to put a round peg into a square hole. Try to force something to be the way it was when life circumstances and physical abilities have dramatically changed. Take all that into consideration. And this is my own quote when somebody asked me what it was like to be a caregiver. Dedicated caregivers come in all sizes, shapes, ages, ethnic backgrounds, and have a variety of educational and personal experience. I consider them great people. Because they didn't ask to be a caregiver, the role kind of happened in their life journey. Who love many, give much, and serve others helplessly. Plan ahead, start early, do your homework. Don't think you can do it all by yourself. We all need a shoulder to lean on. Know that there are agencies, support groups, professionals in the community who do everything from the nursing, problem solving, connecting to resources, to private fiduciaries, associations and conferences. This is a real plug for me to say one of the things that attracted me to go on this board, because I don't have anyone in my family that's had Parkinson's, and many of the board members have had firsthand personal experience. But I'm into education, and I think the more we get educated, the better we are in whatever it is we're doing. Teaching classes, or being a caregiver, or giving lectures. So we will be doing a conference again next year in April 6th, sorry. That's why we have Jane there. And know your resources ahead of time so that when you need them, you're not struggling, where do I go to get them? Gail Rink, a real pioneer in end-of-life work in this community at an Alzheimer's conference, I think back in 2007 or 8, closed her presentation for family caregivers by saying, service to someone you love is a gift of life. What a gift. Thank you very much. Questions? Yes.
Your notebook that you were preparing, is that your creation or?
Yeah, it is. It is actually.
There isn't a starter pack or anything?
You could probably go online and just type in care plan.
Yeah.
And you can certainly look at the way I've put it together to give you an idea. Some people, as I've said, just have spiral notebooks. I find this easy because you know where to go for the medicines, you know where to go for the directive. The care plan should be an outline.
Could you run down the
Oh yes, so my tabs are care plan. What are the illnesses? What are the physical limitations? And how are we addressing those needs in the care plan? So if mobility is getting limited, you would say walk with standby assistance, make sure the caregiver, care receiver, the client uses a walker, remind him to use the walker when he walks. Maybe remind to pick up the feet, verbal reminders. It might talk about weight. Maybe if there's weight loss, they need to weigh the person daily and offer supplements. So think about the activities of daily living and address those subjects. Activities of daily living: bathing, dressing, eating, toileting, socialization, all of those are part of it. They should all be addressed. Daily notes: what happened during the day. Went for a walk outside, son came and visited, had a nice chat, took his dad out to lunch, whatever it was. Maybe there was a conversation where the care receiver talked about being sad or depressed, that he's so dependent on his loved ones. This would be important for a family member to be aware of so that they could address it. Then, of course, the medications. Included with the medications would be allergies. If there's anything that the person has been allergic to. Did they take the medication? Did they keep the medicines down? Did they throw it up? Did they have trouble swallowing the medicines? Maybe they've got capsules and they can no longer easily get the capsule or the caplet down. So these become important. And then incident reports. Something that's unusual that you want to be sure the family or the responsible party is aware happened that day. Great questions. Anybody? Yes, sir.
You mentioned the importance of not waiting too long to start long-term care, start taking benefits. And that really resonates, but I still don't know.
So you have, so every single long-term care policy has its own provisions. And I've probably read 10 different varieties over the years, and each one is unique to that particular policy. So whether it's, I don't know, Prudential, I don't know some of the companies, but it usually requires a need for assistance with 2 or more activities of daily living before you can qualify. Does that sound reasonable, Barbara? So if there are cognitive limitations, that can be a qualifier as well, because it means that the person may not be safe to live alone, even though they're independent in all their activities of daily living. So the policy will pretty much dictate. Some go into effect immediately. Others, you have to pay out of pocket for the first 30 or 60 days, and then it will kick in. Some require that you go through a home care agency. Others will allow you to hire privately. So the gamut is pretty wide. Get your policy out and read it, especially if you bought it 20 years ago or quite some time ago. And for many people, it's a godsend, really, to be able to keep their loved one at home and have help in the home. And some policies provide outstanding benefits. Barbara, anything you want to share? Did everybody hear that? Her policy, she found that by hiring a certified nursing assistant who goes through 150 hours of training and learns the techniques of all the activities of daily living, safety, and all of that, that her policy would pay for that person even if they did not belong to a formal home care agency. So she could hire them privately if they were certified, meaning they have a number through the state indicating they passed a test and had these 150 hours of training. So that's a great program. In fact, I have a very close friend. She moved to Camarillo, and she was worried, should I start the program now or not, the long-term care insurance. And her husband, I don't know what type of dementia he has, but he's physically pretty limited, and they're toying with, is he ready for hospice care at this point? At any rate, she called her with me there to help her coach on the answers to the questions, and she got the insurance to kick in immediately. Just by, and they had a FaceTime conversation, and we took it over to this woman's husband so that the care manager, long distance, could see how physically limited he was, and the case manager did a little mini mental. What month is it? I think it's December, and it was May. So, yeah, and she has 100% coverage. So it's the gamut. The other thing that I really want to point out, because this started 3 years ago, she said, would you look at my policy? It keeps going up every year. I said, how long have you had it? She said, oh, we each have it, probably at least 20, 25 years. And I'm wondering if I should keep it. I said, are you crazy? That would be like taking the $30,000 that you've paid over this period of time and flushing it down the toilet. So take the $800 increase that went up this year and divide it by 365. Oh, that's not so bad, is it? 365 days in a year. If, pardon me? Oh, once you start collecting, it pays for itself, no doubt about it. She is already, and she only has a caregiver 5 days a week, 5 hours a day, and she's hired the person privately. I mean, she can't stop thanking me enough that she didn't cancel it. So, yeah, if you've paid in, don't cancel it. Another question? Okay. That's correct. Once you start taking the benefits, you no longer pay the premiums. That's pretty good. I'm going to stay around. I want people to have some goodies because a number of us baked some things and we want you to enjoy. So thank you so much. The questions are great, and thank you. Thank you for coming.